Hello, good morning, good afternoon, good evening, wherever you might be. I'm Dr. Garry W, one of the board certified sports medicine physicians here at OrthoVirginia. And what I wanted to do today is take a few minutes to talk about a question I frequently get in the clinic every day about a particular procedure that we offer here at OrthoVirginia for the non-operative or non-surgical treatment of certain tendinopathies, which is a category of tendon problems. You see, not all tendon problems are created equally, and there are actually many different types of tendon issues. And so, in choosing the right procedure and the right treatment and the right plan for the right problem in the right patient is at the core of a successful outcome for our patients at OrthoVirginia. So let's talk a little bit about this procedure. That procedure is called tendon bereavement, or tendon hydrodissection or tendon scraping, which can be done non-surgically. So I'm going to share my screen here. We'll talk a little bit about that. And the first slide that we're going to talk about here is just how there are different types of tendon issues. So you may have heard of the term tendinitis. Okay, that's a very commonly used term. That's a very common type of tendon problem, meaning pain that's coming from a tendon or a tendon that's not working properly, but it's actually not the only type of tendon problem. And so a more accurate term when they talk about just a generic tendon issue is tendinopathy, which means diseased tendon, of which tendinitis is one type of it. But there's another type of tendon problem called tendinosis that I want to talk about here. So as you can see on this slide, there are many different types of tendon issues. We have tendinitis, tendinosis, tenosynovitis, peritendinitis, etc. And some patients will have more than one type. But today we're going to focus a little bit on tendinosis. So what is tendinosis and how is that different from tendinitis? So one way to think about tendons is that they're like ropes. And I've spoken about this before, but a quick review will remind us that tendons are made up of multiple collagen and protein fibers and certain cells that we call tenocytes that are basically braided together to form what is similar to a rope. And just like those nylon fibers in a nylon rope are tightly packed together, so is a normal tendon. And that tendon has a certain elasticity to it, certain stiffness to it, certain tensile strength to it, okay? And the tendons are braided into muscle on one side and often attached to bone on the other side. The muscles contract and pull on the tendon, and then the tendon being attached to the bone helps pull and move our bone, and that's how we move in our skeleton. Now, most of us are familiar with tendinitis, and what that is an inflammation in the tendon. So as you can recall, if you overuse a tendon or if you overwork a tendon, you can get increased blood flow into the tendon, which causes an increased amount of blood in between those fibers inside the tendon. Imagine if there was increased blood flow in between the fibers of a rope, and you're kind of starting to see what tendinitis is like. But with that increased blood flow, there's a little bit of inflammation in the tendon, and we get tendinitis. But along with the blood flow, that inflammation also brings in some healing, and over the course of a few days to a few weeks, we heal up from tendinitis for the most part, as long as you don't have any other inflammatory conditions, and we feel better after a few weeks and we move on. And that's typical of a lot of tendinitis that we see. What I'd like to talk about today is tendinosis, a little bit different. And what we have in tendinosis is more of a chronic degenerative condition where we have kind of a wearing out or a breakdown of that tendon rope-like structure. So you can see in this picture here on the right, the difference between the right and the left is that those fibers of the tendon rope is a little bit more frayed, wiggly, and kind of split. Okay, we have some wearing out of that tendon. And in a lot of ways, using that same analogy, you can see here on the left side a normal rope, but on the right side some worn out rope, and that is kind of what tendinosis is like, where you get some wearing out of the rope, some thickening of the rope, some fraying in the rope. If you were to draw a comparison to tendinitis, rather than increased blood flow, we often actually have, in general, decrease of nutritive blood flow to the tendon. So the tendon's a little devitalized. And instead of the blood in between the fibers, the spaces are filled with this mucousy type of fluid, and the fibers are a little bit more frayed and look like kind of crab meat. And so you can see here the difference between a worn rope versus a new rope, and now you've got the difference between tendinosis and, say, a more normally structured tendon. The issue with this is that this is a degenerative condition that sometimes is compounded and worsened by nearby blood flow, abnormal blood flow. And this usually happens when there's a nearby fat pad. So, for example, if you have a fat pad nearby the tendon, as the tendon is trying to heal, you might get blood vessels sprouting from the nearby fat pad, trying to help the tendon heal and remodel and otherwise respond to the tendinosis. But the problem is those blood vessels that come from that fat pad are usually abnormal. They're often leaky, they often are disorganized, and they often bring in abnormal nerves as well into the tendon and kind of invade that tendon, kind of weakening that tendon and actually adding to the degenerative tendinosis as opposed to helping. So you can see here in this picture some examples of what a nearby fat pad may do. And those, you can imagine those blood vessels kind of invading into that tendon, making matters worse. So this adds to the degeneration that happens in tendinosis nearby these fat pads. Two classic examples. Here's one, the patellar tendon in the knee. So you can see here in the knee, you have this tendon called the patellar tendon, and there's a fat pad underneath it called a Hoffa's fat pad. And that fat pad can be a source of those abnormal blood vessels going into the patellar tendon and preventing it from healing and adding to that degeneration. Okay. Another example is the Achilles tendon. The Achilles tendon down by the heel also has a fat pad that sometimes is the origin of these abnormal blood vessels. That's called Kager's fat pad, as you can see in these pictures here. And imagine those fat pads sprouting blood vessels into the Achilles tendon, preventing the tendon from responding properly, remodeling and healing from the tendinosis. And you're left with these abnormal neovessels, as we call them. Neovessel means new blood vessels that are sprouting into that fat pad, from the fat pad into that tendon, basically further worsening the situation. So there's a procedure that we can do to help that. That's called tendon Brisement, also called tendon hydrodissection and scraping. That really describes two different components of the procedure, where we basically try to break up those connections, kind of break up that connecting and bridging abnormal blood vessels and abnormal nerves in order to give the tendon a break from that degenerative invasion from those blood vessels and nerves, and allow the tendon to heal and remodel with other things like physical therapy. We can do this to both the patellar tendon and the Achilles tendon, and here's a diagram showing what that might look like. You can see this needle being introduced between the Achilles tendon and the Kager's fat pad in order to inject fluid in order to separate those two, the fat pad and the tendon, as well as using the needle to perhaps disrupt or break up those blood vessels and nerves. So here's a video showing what that might look like. So what we have here on the right side, this bright white line here, is the patella, the kneecap, and this stringy tendon on top is the patellar tendon. And using Doppler signal, you can see all this red signal. These are the blood vessels going into that tendon from the fat pad below. You can look further down on the tendon. This is closer to the bone down here. You can see less of those blood vessels. But returning to that part of the tendon that's particularly diseased, you can see these blood vessels that are sprouting from the deep surface, which is where the fat pad is, invading into that tendon. So what we do is we do a procedure where we first clean up the area. We introduce a smaller needle to first numb the tissues and break up those blood vessels. So here is an image of my needle going between the fat pad and the tendon, injecting some fluid in order to numb that tissue, okay? Then what I do is using that same needle, using a combination of picking, slicing, probing techniques using the needle, as well as injection of fluids in order to split that tissue plate. As you can see here, this white dot right here is the tip of my needle. As I basically maneuver the needle you can see that I'm actually cutting some tissue there with the very tip of the needle, perhaps using some injection, as you can see here, splitting the fat pad below away from the tendon. Notice how we're not going into the tendon at all. A lot of care to not put the needle into the tendon, but rather putting fluid around the tendon and scraping. Here I am going above the tendon just to make sure that there aren't any blood vessels coming into the tendon from above. So you can see that once we're done, the needle can move fairly freely along both surfaces of the tendon, the top and the bottom, without snagging on any blood vessels. And you can see that same imaging. Now you don't see that red signal anymore, showing what we saw earlier, which is now it's on a loop, showing those blood vessels invading into the tendon. So what can we expect after the procedure? Well, it is a procedure where we are kind of splitting tissues and dissecting. Granted, we are doing it through just a needle poke and not cutting with a scalpel or anything like that. But we are using a needle in order to split that tissue plane, dissect it, and that causes some pain and needs some recovery. And so we expect that right after the procedure, people are going to feel worse as they recover from the procedure itself. People often feel worse for the first couple of days. They rebound from feeling worse by the end of the first week, and they gradually return back to their baseline of symptoms and pain, like how they felt before the procedure, after a few weeks, okay? And they're kind of back to like feeling like nothing's really helped, okay? But what we've done is disrupted those invading vessels. And if we add other efforts like from rehab, like such as physical therapy, we will now see that the rehab actually has a greater chance of infecting the tissue and helping it remodel without those new blood vessels interrupting and interfering. People do get better after a few weeks, and they continue to improve until they plateau at some point after a month or two, and then we kind of assess and see how they're doing and decide whether we need to repeat this procedure or not, or whether we need to do other things and other treatments for this tendinosis. So with that, I hope that this was helpful for you. Once again, this is a procedure we offer here at OrthoVirginia, often by many of us non-operative sports medicine docs like myself. And if you have any kind of painful tendon condition or tendinosis, or if you're wondering if a procedure such as tendon Brisement under ultrasound guidance may be right for you, please come into OrthoVirginia for us to take a look and a consultation. I hope this was informative for you, and hope you have a wonderful day.